Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question in this series of questions from my client Veronica. And the question last week was part 3 of my 71-year-old dad is in intensive care with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from one of my clients, Veronica, which are excerpts from phone and email counseling and consulting sessions with me. The question this week is part 4 of my 71-year-old dad is in intensive care with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? And again, that's part 4 in this series of questions. So, Veronica writes, Hi Patrick, at 9 a.m. I saw Dad prior to the meeting I had with his oncologist and got his levels from the nurse and all the reports I needed. Dad was sedated still at the time and not responsive. His levels this morning were his PaO2, also his oxygen levels in the blood, were 84.1. His PaCO2, his carbon dioxide level in the bloods, were 46.2. His oxygen from the ventilator was still at 45%. His arterial blood pH was 7.38. His oxygen saturation was 96.3. His hemoglobin was 101. His potassium 4.1, lactate 1.7, and he's getting 2 mils an hour of noradrenaline or norepinephrine. I also asked about his kidney function and they said fine and no concerns at the moment. His ventilator is set to volume 400 mils in SIMV mode and he's breathing also by himself, but was not in sync with the ventilator. At 9:48 a.m., Dad's oncologist met with Mum and myself this morning and he showed us Dad's scans from his iPad so we could see what is happening in the lungs, and it looks like they are honeycombed and stiff. He discussed the steroid treatment they started yesterday and the possible cause of Dad's lung fibrosis, he believes, is a side effect of the trial immunotherapy drug Dad had been on that is known to cause lung fibrosis over time. Dad's oncologist also believes it might be able to be reversed with the steroids over a long period, but time will tell. He advised us that he doesn't have as much control in the hospital and influence on Dad's treatment as the head ICU consultant, and that if Dad was in the public hospital, he would have been dead by now. He told us he's really pushing to keep Dad on treatment as he also believes it is the right thing to do, as he thinks there is a possibility of reversing the pulmonary fibrosis as he thinks it has only shown up recently. At 10 a.m. after the meeting with the ICU consultant and the oncologist, I went back in to spend more time with my dad, and the nurse advised us that she turned the ventilation into pressure support ventilation, or also known as PSV or CPAP, as Dad was not breathing in rhythm with it and he didn't need it as he's breathing on his own, and she reduced the level so he's now just getting assistance from it. She also said it will be better for Dad to have less sedation and reduce his propofol from 30 to 15. She said he would start to wake up and it would be better for him in the long run, as long as he's not resisting anything. Dad started to respond to us very quickly and could answer by nodding to questions and move his arms. We left at 10:30 a.m. I called the hospital again after lunch to see how Dad was, and the same nurse said no change since we left and that Dad is not in any pain and he understands what is happening and is not resisting his treatment. She advised me she would not be increasing the sedation overnight as long as Dad is not distressed. I have not heard from the hospital tonight. So, I will call them again in the morning like normal to get his blood levels again. I am visiting Dad after work tomorrow at 3:30 p.m, hoping nothing has changed and everything is improving. The challenge for me at the moment is that the professor of the ICU has to write up the steroids for Dad, and today he didn't, and I had to chase it up to make sure Dad got them, which he did get them eventually once I advised them to. He is going to be a problem, this professor of the professor and the ICU consultant, and I will now have to check daily to make sure Dad is going to be given his steroids. Many thanks from Veronica. Also letting you know, Patrick, that the professor and the head consultant of the ICU is keeping away from us at present. And before I get into my response, if you want to get one-on-one counseling and consulting with me, just check out the options on the top of the website for one-on-one counseling and consulting and select from the options that work best for you. So here is my response. Hi, Veronica. I'm glad to hear that the oncologist is keeping the ICU consultant on his toes. On the one hand, I'm shocked to hear that you have to chase up the steroids for your dad. That's very much public hospital mentality the ICU consultant is bringing to the table. If anything, I call this negligence on the ICU consultant's behalf, and I feel like he needs to be called out on it. It's disgraceful. If you're back in the ICU tomorrow and that's still an issue, you may actually bring this to the nurse in charge or unit manager's attention. You may also report this to the hospital CEO or to the director of nursing, as in the private system in particular, they will be responsive to your complaint. Especially if the ICU consultant is trying to avoid you because you need to chase up steroids, you need to escalate this to hospital management as soon as possible. If anything, I do actually think that hospital management would want to know about this sort of stuff happening in ICU because they often lack this insight, and I do believe they will take this rather serious from my experience. You having to chase up treatment in intensive care for your dad that has been arranged by the oncologist is just highly inappropriate. Your dad's oncologist will not be, the ICU consultant will be getting away with that sort of thing in the public system, but not in the private system if you're reporting this to a CEO or director of nursing level. Your dad's blood gas is looking okay. PCO2 or carbon dioxide has gone up slightly. 45 to 50 is usually the highest limit that can be tolerated. You also mentioned your dad is getting around 400 mils per breath, and if his breathing was desynchronous, I'm not surprised that his carbon dioxide level is up compared to yesterday. It is suggested that patients should breathe 7 to 10 mils per kilogram per breath. Therefore, I assume your dad is more than 50 kilo. He should be getting more than 400 mils per breath. That would probably get his PCO2 back in the 35 range. It's very positive to note that they changed the ventilation mode from SIMV to pressure support ventilation, also known as PSV or CPAP. It means your dad is awake enough to breathe with minimal support, therefore he's coming closer to getting off the ventilator. For example, now they should be able to switch off the propofol and they should be able to get your dad more awake. This may not happen straight away, and it can be a process of a few days when coming out of an induced coma. And also on the positive side, your dad's oxygen level or PO2 at 84 is a good reading. I'm glad to hear they are weaning the propofol. I'm glad to hear that your dad is following everything that's happening. It's really encouraging. 2 mL an hour of noradrenaline should come off once your dad is off the propofol. One of the main side effects of propofol is low blood pressure, hence the noradrenaline or norepinephrine, which is an inotrope or vasopressor counteracting low blood pressure. It's also good to hear that the kidneys are working, and that's a sign that his blood pressure wasn't too low, because sustained low blood pressure can cause acute kidney failure. The question forward will really be if your dad can come off the ventilator and the breathing tube. They will need to continue the arterial blood gases as well as chest x-rays in order to get an indication if they can take the breathing tube out, which is also known as extubation. Also, have a look if they wean your dad off the ventilator according to the guidelines that are put below in the written version of this blog. So have a look for the article, How to Wean a Critically Ill Patient in Intensive Care off the ventilator and the breathing tube. Go and scroll down from this video below and click on the article and the video and you can watch it there. Anything you need to know, please let me know, Veronica, and we'll talk tomorrow. Thank you. And how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab and on the top of the website. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.